really happy to introduce George. George is a long-term practitioner, loyal BXC member. I actually first got to know George a little bit during COVID when he was trying to find ways to treat frontline NHS healthcare practitioners during the pandemic, which was very forward-thinking and quite brave. And I think that kind of sums up George's career. He's really brought a lot of passion to a number of different areas, and not least of which the pulse, which is what he'll be talking about tonight. So I'm really excited to hear his thoughts on the pulse and how, the creative ways that he approaches it. So, George, I'll hand over to you. And
Thanks so much, Alex. Thanks for the warm welcome and welcome everybody. So I'm really grateful that you've all tuned in. And I think quite possibly, I don't know how confident or lacking in confidence you all feel, but there was I remember a survey that was done in the British Medical Journal a while ago, 2012, I think, where 68% of practitioners said that they weren't confident in reading a pulse, using it as their main form of diagnosis. So I wanted to really talk to you about what I do, my development, the history, the development of pulse diagnosis itself around the world, and to hopefully inspire you to really look into pulse reading again, and to consider that there might be a much better way of doing it than you were taught in college. I think really this is something that could replace the 28 pulse qualities, because it is so much richer. So let me share my screen. Yeah, so the secrets of pulse diagnosis, and unlocking them, is we really want to be able to impress upon patients that we use a holistic medicine, and we have herbs and we have needles and we have, gua sha instruments and moxa and that sort of thing. But really, we're not like modern technology. We're not, we don't need a wearable watch that needs to be plugged into a socket. We don't need, a blood pressure monitor. One thing that I find very interesting is in the West, we had pulse reading, as we'll go into in a minute, and it slowly got phased out. We had the sphygmometer, the doctor's thing with the thing in the ears and the round bit you put on your chest, and that took us away from the palpation, from the hand of the practitioner on the wrist or the neck of the patient. And that's something really that modern technology, as you'll see, just simply cannot compete with. The most brilliant AI technology still can't come close to what we can do with our finger on a pulse. So a little bit about me. I qualified in 2011 at the College of Integrated Chinese Medicine, and I've been in practice now for 14 years. I both have a suburban London practice, which is regular price, but I also treat high net worth individuals, both in a central London clinic and at their homes for ultra high net worth patients. But I also founded the Get Well clinics in London in 2014, which is affordable community clinic clinics actually, where we treat high volume of patients, and have a business model that actually makes it so that the acupuncturists get well paid, get a huge amount of experience, and the patients get access either to more treatment or get access to treatment when they otherwise couldn't afford it. But I've actually been studying pulse diagnosis for longer than I've been in practice, considerably longer, since I had my first acupuncture treatment. And it just blew my mind. Yeah, so now it's the primary way that I diagnose. I don't look at the tongue. I will use questioning to support my pulse diagnosis, so I can understand what it is that I'm feeling and verify how accurate it is, and to tailor what I'm feeling to really help the patient, both in the short term and the long term, to overcome sometimes very chronic physical or emotional conditions. So sort of things that people say, about me when they're leaving reviews or posting about it on social media. His ability to read intent of bodies is exceptional. He's clear, and he's clearly a master of his field. Uh, Being able to tell what people have had to eat, not only last night, but also, in the last few days, and looking at the history of the digestive system going back many years sometimes. In the same way that you can do this with the digestive system, you can also do this with tumors, with uh, with scar tissue from surgery, um, and being able to pick up on this and see the state of it, because I'm sure a lot of you know scar tissue. We the general public thinks that you get scar tissue and that's just the way it is, but actually, a lot of scar tissue can be broken right down, and then the nerves and the blood can be reinvigorated, and the site of trauma can be much more rejuvenated. So originally, I'll tell you a little bit about me and how I came to Chinese medicine. So I drank very heavily when I was a teenager and in my early 20s. And my liver and my kidneys ached all day, every day after I stopped drinking when I was 22. And I looked at all sorts of things, psychosomatics, so hypnotherapy and mesmerism, and self-hypnosis, dieting, fasting, with the liver and kidneys aching all day, every day. Uh, the doctors just said that they could give me pain relief, but I wanted to rejuvenate my body because I was so young and I'd really screwed it up. About 4 years down the line, someone recommended me to go and have acupuncture. They said, "You're not as healthy as you think you are." So they gave me the number of Adrian Stoddart, who practices in Southwest London in Southfields. And I called him up as soon as I got home, and booked an appointment for, I don't know, a day or two later. And I went along there and he said, "What's wrong with you? What have you booked in for?" And I said, "Well, nothing's wrong with me." And then proceeded to say, I drank quite heavily. And so he read my pulse and he said basically this. He said, "Okay, so when you were young, you did a lot of exercise, so your heart grew very big. It was a big muscle, and so your heart rate is quite slow. It doesn't need to beat that hard to push the blood around the system. But as you got older, I suspect you had led more of a hedonistic lifestyle. You didn't look after yourself so well, and so your blood became dirty. Your blood became dirty because your liver and your kidneys were struggling to detox the blood, and what you're putting into the body was not of the best quality. So now you have dirty blood feeding a slow beating heart. So we need to strengthen your liver and your kidneys, tonify the heart, and clean up the blood." And this just matched exactly what had happened in my life. I thought, how the hell did he do that? I've got to learn how to do that. It's incredible. So from there, I was just hooked on the pulse. And he wouldn't teach me, Adrian, the bugger, because he said he's a practitioner. He made a decision a long time ago. He's a practitioner and not a teacher, which I respect now. And it also gave me the impetus to go and find out for myself. So he had learned Shen Hammer system. And then when I went to College of Integrated Chinese Medicine, like most people, I studied the 28 pulse qualities, and the supervisors and teachers there, they teach you all the theory and they do their best. They're also probably teaching tongue and Chinese syndromes and acupuncture point location and point, the qualities of each points and anatomy and physiology and anything else. So they've never had an opportunity really to master the pulse, and quite possibly they're just treating 10, 15 patients a week. So compared to me feeling 65 to 75 pulses, treating that many patients a week, I get a huge amount more experience than them. And then a few years down the line, my pulse reading had become very good, but it wasn't structured. I couldn't teach it to anybody. I couldn't really explain my system to anyone, even though it was proving accurate and it was getting me good results. And then I met Bob Doane, and I don't know how many of you have met Bob Doane, but he's a wild Alaskan, and he's a genius. I find him a very difficult character as well, but he's absolutely phenomenal Chinese medicine practitioner with herbs, with acupuncture, and with diagnosis. He's got the biggest clinic in America, one of the biggest clinics in America, with 14 rooms and seeing, 80 to 120 patients a day. Not just him, he's got a team. It was very impressive. And he had learned from Jimmy Wei Yan Chang. Jimmy Chang is a Chinese practitioner who was self-taught, actually, and qualified without education in Taiwan, which is the hard, it's very hard qualification. And he was never taught anything by anyone apart from himself. And he passed that, moved to California, and treats a very high volume of patients. He just does herbs now, so he can treat people in 5 to 10 minutes. And both these guys, and Adrian, all of them, and my other mentor, John Tyndall, all treat a high volume of patients. So that was always how my mind was focused. And my business is all, even my private practice is focused around treating multiple people at a time. So next page. Here we go. Okay. So why is pulse diagnosis? What's the big deal? Why do people say it's such a useful tool? Because we've got tongue reading, we've got questioning, we've got signs and symptoms, we've got facial diagnosis, voice, color, smell, color, sound, emotion, odor, fingernail diagnosis, eyebrow, nose, and philtrum diagnosis. I mean, it just goes on and on. You can abdominal diagnosis, but pulse diagnosis generally has been seen as the greatest tool of them all. So Wang Shuhei, who wrote the Pulse Classic, which is a pretty tricky read. I must say I haven't got very far with it at all. Some people like to study it, but a lot of people find it indigestible. But he was really seen as a pulse master about 1800 years ago. And he said a physician who fails to read the pulse is like a blind man crossing a river. Charaka, which is an author, one of the founding authors of Ayurveda, one of the founding texts for Ayurveda was written by Charaka or Charaka. And among all diagnostic methods, pulse examination is supreme. A physician's skill lies in its mastery. Bian Cui, who is the earliest pulse master in China, looking is unreliable, questioning is limited, but the pulse tells the truth. And then Ibn Sina, if any of you know who Ibn Sina is, absolute legend of Unani medicine in Persia, which was a mix of Greek and Chinese, Indian, and Arabic medicine. The sort of physician who masters the pulse needs no other guide. He also wrote a lot about pulse. So the pulse is faster, more in depth, and more reliable than other methods. Although in Chinese medicine, a lot of things, the tongue can be very fast. It is very comprehensive. So certainly in terms of if you want to send someone for a blood test, that's going to be a while. You have to send that off. They have to analyze it, and then they have to send it back. So that can take, a day to a few weeks. It's very good at establishing rapport as well, because you're there with the patient with your hand on them. And in minutes, even without them speaking, there's a huge amount of information that you can elicit. And it's very, very holistic. The tongue will give you some insights. The abdominal palpation will give you some insights as well, but nothing gives you as holistic a picture as reading a pulse. And it changes immediately. It's not telling you, the tongue, how fast is the tongue going to change? The tongue's going to change maybe in 6 months if you're lucky, probably more like a couple of years. So it's very good for initial diagnosis, but it's not very good for ongoing diagnosis and to analyze how well your treatment is actually happening, how effective your treatment is on the patient. When you read the pulse, you can find out within seconds. And of course, what a lot of these masters have become known for is being able to diagnose imbalance. So before disease has arisen, even before infection has arisen, or mental and emotional health problems have arisen, if you can identify the imbalance and identify the tensions that the person is holding, then you can help them to relax that, and you can avoid the development of disease. So plunging into the history a little bit, even in Western medicine, it's still key. If you go to the hospital, most likely the first thing they're going to do is they're going to take your heart rate and your blood pressure. It's still absolutely vital in all systems of medicine. It's just that in Chinese and Ayurvedic medicines and Tibetan, it is just developed far better for the practitioner, one practitioner, to be able to diagnose a huge number of issues just with their finger on the person's pulse. And it goes back to the oldest manuscripts we have on medicine, the Ebers Papyrus, cuneiform tablets, they even tablets from the Babylonians, where they were indicating that reading the pulse gives an idea of infection and other signals of health. And the Aztecs. And as we'll see shortly, there's a recently deceased Mayan master who was an extraordinary pulse reader as well. So let's have a look at the people through history, because I'd really love to inspire you to really dive deep into the pulse and go beyond your current progress. So Hippocrates, the father of Western medicine. Lovely little picture of him here on the right. There's no actual accurate bust or depiction of him anywhere. But he was not a pulse reader. That's important to say. But he did write about how analyzing the pulse, particularly vascular, strong vascular pulsation, could signal an aggressive fever, aggressive infection. But also disease could be diagnosed, and to diagnose the state of the disease by the condition of the blood vessels and the blood. And of course, the theory, although he hadn't tied it together at this stage, the theory that he developed, the humoral theory, associated emotions with body fluids, that emotions and the mind are not just something independent of the body, but were integral to the functioning of the body. But then Galen, this geezer here, Turkish guy, the Western pulse master, very early on wrote De Pulsibus and 8 other books actually purely on pulse diagnosis. So he was really, I assume that he learned from the Chinese, the Indians, and whoever else, because his work resembled much more Chinese medicine than Ayurveda. And he really saw it as something that could, you could read the emotions and read the spirit. So yeah, the first evidence in the West that we developed great sensitivity to the pulse. Then Bian Chui, the Divine Doctor. That's a pretty cool nickname, right? The Divine Doctor. That's pretty impressive. People obviously saw magic in his abilities. Of course, to him it was a science, but as far as I could tell, it was magic. And he predates the Huangdi Neijing, and was very influential in what was written, apparently, what was written in the Huangdi Neijing. He really, as a divine doctor, as that name suggests, he really built a legendary status for himself, being able to diagnose illnesses before symptoms appeared, and not bringing a prince back to life, but stopping him being buried and stopping him being declared dead by realizing that he still had life in the pulse. And then the following king, the following emperor, he saw that his pulse was a cold disease, an issue with cold invasion. The king ignored him and thought it was a heat invasion, promptly died, and that just only went to support Bian Chui's legendary status. At that stage with Bian Chui and during the Huangdi Neijing, there wasn't an association of the organs tied to the pulses. And they weren't just looking at the radial artery, they were also looking at the Chunku, the radial artery, but also the Renyin, the carotid artery. And they were looking really at the difference between qi and blood. If the Renyin, the carotid artery, was stronger than the radial artery, then that suggested that it was a qi condition and that heat was more involved. And when the Huangdi Neijing was written, we were first introduced in China to this idea of the three depths, from skin to superficial, middle, deep, and bone, that we all know. It also placed a lot of emphasis on circadian rhythms and seasonal rhythms. Personally, I don't really bother with that. I don't see the value in that. I do agree that in the morning the pulse will be more yin, it will be softer, and in the evening, as you've been asleep and as you start moving, then it will be more vigorous. And with the seasons as well, it's supposed to be more wiry. The Huangdi Neijing says in the spring, in the summer it's more overflowing, the fire element with the heart, the lungs. The autumn is superficial. Everything's uh, risen up a little bit more, and then the kidneys in winter is more is a deeper pulse. If that's the same for everyone, you can basically ignore it as far as I'm concerned. It's very interesting, valuable information, but not really clinically relevant in most cases. Then we start developing the structure that can be that can provide a lot more depth for people to learn, which is Wang Shui's Mai Jing, the pulse classic that I mentioned earlier, where he introduced the Sun or the Chun, the Guan, and the Shi positions, and 24 pulse types. So we're starting to really divide up and systematize and create an architecture for people to be able to learn from, a good mental structure for people to comprehend and break down what it is they're feeling into categories. That's really important in being able to teach anything. You must have a system that people can follow. However, he was probably a little bit too strong on the emphasis of the theory and the structure, and all the way since he wrote it, there seems to have been criticism about the difficulty to follow what he wrote. But a great quote: "If one does not examine the pulse in diagnosing disease, there's no reliable basis for judgment." Just an example that another master really valued, a Chinese medicine master really valued the pulse as a key diagnostic tool. And then Avicenna, as he's called in the West, Unani medicine, as I said, is a combination of, I mean, it's really Greek, inspired by Hippocrates, but then it took all sorts of influences from around the world. We think that we travel now a lot more with boats and planes, but it looks like actually people have been traveling around the world for the longest time and sharing knowledge. And particularly, I think, with Genghis Khan, and how he allowed all different cultures, encouraged all different cultures to kind of like Marco Polo should go and hang out in China and Japan, and everyone should share their knowledge, share their skills, and mix so that we can all become wiser and greater in our cultures and in ourselves. And the canon of medicine is a number of books that he wrote 1,000 years ago, which was again really legendary and really key in teaching medicine throughout the world, really. And he was also said to be extraordinary at reading emotions, reading the spirit, and reading the physical body. Next up, Li Shizhen, who wrote the Binhu Maichui, the Lakeside Master's Study of the Pulse, which is also another classic. And he developed things in a number of ways. To be honest, I haven't read his book, any of his books, but he is another prominent figure who was very inspiring for many generations. And he said that it's really the radial pulse in the wrist is a great indicator of what's happening in the organism is in front of you. Ayurveda, where it's very similar. You have three positions, you have three depths, and they relate to the doshas. And there are a number of key players in this. Charako, who we mentioned earlier, and Sushruti, they are the two real figureheads who have the key texts when you're learning Ayurveda. I haven't studied Ayurvedic pulse reading. I'm not sure if any of you have. I've heard some people study both, but they're two holistic systems of medicine. I don't really see why you need to learn both. But it's very interesting to see that they are both very holistic. They're very ancient. They are still extremely valid today, extremely popular because they work. And nowadays, Vasant Lad, in particular, the guy on the bottom picture, has got the best reputation as the key pulse master worldwide, really, in Ayurvedic medicine. Then also Tibetan medicine. Tibetan medicine, again, there's a lot of evidence. Let's just bring up this next one. Utog Yantan Gompo. He's a legendary figure, this first character on the right-hand picture. And it's very similar to Greek medicine, to Ayurveda, to Chinese medicine, with these different substances in the body, analyzing them in the pulse. And again, with Utog Yonten Gumpo, he's got, I mean, very legendary mythical stories about him, how he not only treated humans, but he also treated the spirits. And he, and the gods, and he wrote the 4 medical tantras, which is still key today. And nowadays, this bottom picture, Dr. Nida Chenag Sang, who connected with on Instagram. He is a lineage holder of Tibetan medicine in general, but is also key in reading pulses. And this mother and daughter team from the 1900s and this century are also renowned pulse diagnosticians. And there were traces. Even when we started using other systems of medicine, there were still traces of writers who were updating what had been written by Hippocrates and by Galen, and presumably learning a lot from Arabic, Indian, Chinese sources too. And Don Eligio Panti, this guy, you've got to check this guy out. This guy was incredible. There's a long YouTube video of his female apprentice who was with him for about 30 years, I think, or about 20 to 30 years. And he really, where did he get his information from? Because he learned from his teachers, and he said he got all his information from God. And he said, the pulse tells me all. And he died in 1996, but he really was known for being able to tell all sorts of things about people. What is it? 42 different conditions, physical conditions and diseases through reading a patient's pulse, but also being able to treat them spiritually, not only to diagnose from the pulse, but also to treat through the pulse. This is another very pertinent and interesting concept. We use needles or we use herbs, but how about using pulse diagnosis? How about using pulse reading as the treatment? We'll talk a little bit about that in a bit. And he used acupuncture, but he used not Chinese needles. He used needles from nature, basically. So where did he get his information from? Where did these guys get their information from? It must have come from the Far East, surely, but we don't know. And this wasn't him. This is what one of his teachers said. The pulse speaks to you like the trees, like the wind speaks to the trees. I thought that was really touching, and really helps to elucidate this idea of reading the pulse from the heart, not just from the mind. And the Shen Hammer pulse reading system you may have heard of. In modern times, Dr. John Shen updated. He came to America and he updated his lineage, which is very much Chinese syndrome based, to Western medicine for a Western audience. And Dr. Leon Hammer, who's actually a psychologist, a psychiatrist even, and became a Chinese medicine practitioner. He then refined what Dr. Shen had taught him. And Adrian, my original acupuncturist, had trained in that, and I can certainly say is much more advanced than the 28 pulse qualities. Can't talk too much about these guys, but Jeffrey Yuen, probably a lot of you know him, and Anne Cecil Sturman, key figures also who have fantastic pulse reading reputations, and Dr. Shen Pian, or Pian Shen, in China is another modern day person famous for their pulse reading abilities. So one of my teachers, Jimmy, He's quite I would say personally he is got the best of anyone, the best skills of anyone, maybe apart from me, uh, of anyone that I'm aware of in the modern world. And he is a fantastic teacher as well. It's well worth checking him out. And someone who is, it doesn't really divulge, like a lot of these Chinese practitioners, doesn't like to divulge exactly where he learned everything from. Uh, but he's certainly a genius worth learning from. And then finally, Bob. Bob really changed my pulse reading from something that could really help patients, but would die with me, into something even better than I was already doing, but understanding how you could format it, how you could structure it and teach it so that you can take people step by step uh, from being a novice all the way to mastery. And he also, he innovated with the balance method, which he learned intensively directly from Dr. Richard Tan, and he learned directly from Jimmy Chang. And can't remember his herbal master, but he's put his own herbal prescriptions together. And he really inspired me. He's amazing in his approach, where he says improve in all areas all the time. How about we improve on the Huang Di Nei Jing? I never heard anybody say that. Let's improve on the classics. We can do better than that. I think it's a brilliant mindset for everybody to adopt. Never take your position as enough. Always look to improve your expertise. Always look to impress the greatest skeptic. If you have a biomedical, skeptical biomedical researcher who doesn't want to. I had someone the other day actually who was like that. Doesn't want to entertain the idea of qi, yin yang, five elements. Doesn't want to entertain Chinese medicine because they've heard about these terms. Can you talk them around so that they go, oh, hold on a minute. This guy actually knows a lot more than me, or this girl. They know a lot more than me. Hold on, I better listen to them because they're obviously talking a lot of sense, very rational, and they obviously are picking something up inside me, which is true and valid and helpful. So the problems that I see it with modern pulse diagnosis is that there's a lack of pulse masters around in colleges. Uh, if you're treating 10 to 15 patients a week, and you are teaching at the weekend, you're just not feeling enough really to develop a profound understanding of what it is. When you're treating a huge number of people, you can start to work things out over time as you layer information on top of information on top of information. Your intuition needs to be, you need that your intuition will function a lot better the more information you have for your intuition to call on. And so the best pulse readers generally, it sounds like they've all been treating a lot of people. The system itself is inefficient. First off, you have three positions which relate to, I would say, five organs. I don't know how many you think you read in the pulse. Maybe you feel that you can read 12. I don't know if you know what the triple burner is, the Sanjiao, or believe you know what it is. Keep reading kidney yin and kidney yang. How relevant is that? What does that mean? Liver qi stagnation, feeling wiry, even feeling wiry, as opposed to the liver is pressurized. The person is feeling stressed. They are squeezing their liver, which is limiting the movement of fluids in and out of the liver. The nerves are not functioning efficiently. This is the going beyond the theory, going beyond the mental analysis of the pulse into the feeling of the pulse, of the internal dynamics of the individual who's in front of you. That is really where I think we need to transform pulse diagnosis training. And of course, I think we're all aware in China, often you would be with your mother or father and with your grandmother or grandfather, and you would be an apprentice for maybe 30 years with one of them and maybe 40 or 50 years with the other one. And then, of course, university is fantastic. You get your degree, everyone standardizes their knowledge. But then, if you really want to know what you're doing, you're with people who are more experienced with you day in, day out, and you keep doing that again and again. So, any weak areas, any blind spots, you can rely on these people who have come before you, and we can stand on the shoulders of giants. Otherwise, we're always trying to grasp at things we just can't understand, and we can read books, and we can listen to podcasts, and we can try and take these snippets, but studying with a master is something that really empowers your learning dramatically. Both my mentors, I studied with them intensively, and it's the best thing I've done in my entire career. Uh, then also, yes. So the fact that we have Chinese syndromes, you're diagnosing liver qi stagnation. If you're a functional medicine practitioner, you're going to have to learn Chinese medicine if you want to know diagnosis. If you want to learn from an Ayurvedic master, you're going to have an understanding of Ayurveda. So there's a limit. The Ayurvedic and Chinese practitioners can't communicate, can't discuss things very easily because they're talking in different languages. Then they can't talk to other medical professionals, Western medical professionals. This means that it's fractured, and we can't, we really, if we really want to explode the evolution of holistic medicine, the more people we have who are able to read a pulse well, the more from as many different treatment disciplines as possible, the more we can share our knowledge and share our insights and really help practitioners of the future be better and better and get even better results for people. Yeah, so that last point is basically the same. This archaic language also not only separates us from other people, but if you're talking about liver qi stagnation, do you understand what a wiry pulse being liver qi stagnation, what that actually means in a person's body? If you feel loads of pulses and you have a good system, then you'll work it out. You will feel for yourself what it means, and you go, "Oh, that's what liver qi stagnation is. Okay, that's what kidney yin deficiency is. I get it now." It's brilliant for establishing patient rapport when you talk in their language. Is brilliant, as I said, for breaking down cynicism and skepticism. Uh, and you can get much more detailed information. If you're stuck with Chinese syndromes, there's not many Chinese syndromes, and they don't include neurological disorders. They're very limited in a number of ways compared to the detail that Western medicine provides. So how are we going to fix this? One way is to use a better system. Uh, what I learned from Bob and Jimmy is much, much better. The Shenhammer system is much, much better. So from what I've heard, Jeffrey Yuen and Anne Cecil Sturman, their system is much, much better. So go and learn from them. Come and learn from me. Go and learn with one of them. Honestly, it will change your practice dramatically. You will understand what this ancient medicine is talking about better than most people if you do. And it's not a Chinese medicine skill. It is a medical skill. If you take away treatment, then diagnosis can be used, should be able to be used for all types of treatment. And this is what I've stripped down with medical pulsology, my system. Both Bob and Jimmy had transformed it into a Western biomedical format. But to take away these ideas of yin and yang, 5 elements, there is an aspect to it. But it shouldn't be necessary because, again, it separates us all. So if we can have a common language between all healthcare practitioners who practice a holistic medicine and want to use pulse diagnosis, then that can really help. And of course, mentorship, as we've spoken about before. And then always diagnose. When you're treating patients, we'll go into some stuff that you can use from tomorrow in a minute. But feel everyone's pulse every time. And if you inserted some needles or prescribed herbs or given some tuina or whatever it is, and you want to check if it's been effective, you can ask the patient, but also feel for yourself. See if you can feel the difference. And if you are observing someone else, feel the pulse when they stick the needles in. Often you'll feel instantaneous change. It's very enlightening as to what's really helping and what's not helping, also more to the point. So my system, considering you're here, you're listening to me, I'd say come and learn from me. I've got a lot to teach. I've got my first course, first weekend coming up soon. And one key difference from other pulse reading systems is instead of Sun, Guan, and Shi, we're going to extend that up. So those are just center points along the pulse, a bit like the upper, middle, and lower dantian. So that we can really read from head to toe. So we can read musculoskeletal system, endocrine system, accurately read blood pressure, read the heart, not just Chinese syndromes of the heart, but to read the physical heart, the chambers, the valves, the how blood is moving through the coronary arteries, how it's moving through the muscle walls. All of this is very, very possible with a little bit of education. There's also other parts of the pulse, I'll show you in just a moment, you can read, which takes us well beyond what we're taught, what most of us were taught in college. My system from my years since I learned from Bob and learned directly with Bob and from Jimmy from a distance. The one big blind spot was the arms. You can diagnose the shoulders, neck, base of the skull, upper spine, all of that, but couldn't diagnose the arms. I've worked it out. So we can read the whole body now. I have also developed a different way of reading the digestive system, so we can read along from the esophagus to the stomach, small intestine, large intestine, and out, so that you can see how imbalance is arising at what stage. So SIBO, leaky gut will happen in the small intestine, in the middle of the small intestine generally. SIBO, small intestine bacterial overgrowth, I'm sure most of you probably know what that is. That is bacteria from the large intestine backing up into the small intestine. It's a dysbiosis condition. And that is on the join of the small and large intestine, just in the small intestine. And you couldn't feel that in their systems, but you can in mine now. Differentiating also between not only being able to, spelling mistake, gynecological, not only being able to feel the ovaries, uterus, cervix, but being able to identify whether it is polyp, fibroid, endometriosis, or polyp fibroid, endometriosis, or polycystic ovaries, or just a few cysts, around. And if it is endometriosis, I mean, you know how long it takes. I don't know if you know, but to get an endometriosis diagnosis can take years, and it can be very complex. And often it's only really in surgery that they find out if it is actually endometriosis. If you learn where I got to teach and you learn it well, you'll be able to tell in seconds where the endometriosis is, how puffy and inflamed it is as well. And I understand now, which I didn't get from Bob or Jimmy, how to help you go beyond the theory. The theory is in the mind. The theory is a mental framework, but to stay with the theory is going to keep you, again, separated from what is actually the spirit and the human in front of you, the person and their behind the scenes mechanics. So I want to help you leapfrog from the architecture of the theory out into each individual person so that you can feel a sense of mastery. Mastery being when you don't need to ask questions anymore, you can find out for yourself. The student has disappeared. The student is always there, but the master is resident in the heart. And of course, compared to mechanical diagnostics, I very much want to get functional medicine practitioners, homeopaths, doctors, specialists, cardiologists, gastroenterologists. I love them, nurses in a GP surgery. I love them to learn at least aspects of this. It would really change the game because it gives you immediate results. It's completely non-invasive, establishes phenomenal rapport because of this emotional component and because of the seeming magic of it. People just don't understand how you can get this information, but it is a science. The only difference between magic and science is that science has knowledge and magic can't see. The person who sees the magic can't see how it's happening. Uh, and you don't need any equipment. You don't need to carry anything around. You can be anywhere and you can read someone's pulse. I get it all the time. I start to talk about the pulse and people go, "Can you do mine?" And yes, you can. Sometimes you think, "Leave me alone, will you?" It's my time off. So let's look at medical pulsology a little bit and some easy insights that you can take away and use from tomorrow in clinic. So we'll go back to the anatomy of the radial pulse. So the radial pulse only becomes evident, only becomes tangible when the tendon of the brachioradialis muscle, when the muscle starts to recede and then you're just left with the tendon. So the radial pulse starts off with a brachial pulse in the elbow, and it's very deep. So this is important to understand when we're considering a normal pulse. So it comes from deep in the elbow to superficial at the wrist. All right. So rather than the sun, the guan, and the shi being right next to each other, three fingers right next to each other, we're going to stretch that out. And they're all about a finger width. So you've got 5 finger widths, as you can see in that first image. The styloid pulse, that's what Jimmy and Bob call it as well. That is from the styloid process. That would normally be the guan in the 28 pulse qualities, but the guan is going to be where the shi normally is, and then in between the guan and the shi, we've got what I call the mesenteric pulse. I don't know if you know the peritoneum, the mesentery is a part of that. I would say that's what the triple burner is, at least the middle and lower burners. This fascial tissue that holds all of the viscera, all the vital organs in it, and has all the blood, nerve, and water vessels that feed all the vital organs. Certainly in the Huangdi Neijing, there's evidence when they're talking about the lengths of the organs, when they talk about the triple burner, it correlates to the peritoneum when it is dried. All of the organ weights and lengths are all of dried organs. So hopefully also that can give you the idea that we might know and might have known for a long time what the triple burner actually is, rather than some sort of ethereal concept of an organ. And then a proximal pulse. So we want to use the whole distal third or distal half. It depends on how much the person's muscular development is, about how much you can feel. And as well as that, there's the Yang Wei Mai. If you look at the picture on the right, there's the Yang Wei Mai and Yin Wei Mai pulses as the dorsal carpal branch of the radial artery comes up over the wrist towards the anatomical snuff box. There is also a pulse at the anatomical snuff box, large intestine 5. I don't really use that because I've got another position where you can feel the base of the skull, which is what it relates to, where you can feel with more accuracy. Then you don't really need to use the anatomical snuff box pulse. But the Yang Wei Mai is very useful, and the Yin Wei Mai pulse, which is also if we go back to the slide before, you can see that the radial artery is the superficial palmar artery comes up by the I can't remember all the names of these. I've cut them out of here, but just in the middle part of the arm, where the 2 tendons just comes up there, you should be able to feel it at times if you put your finger there. So the artery branches off at the wrist in a number of areas, and we can use those pulses to diagnose further information. And because the radial pulse is deep in the elbow and superficial at the wrist, that gives us what most pulse systems miss, which is the normal pulse. When we stretch the pulse out, then it is logical that the most distal part of the pulse should be superficial and the most proximal should be deep. So that makes the sun, uh, superficial, guan middle, shirt deep. Of course, on the left wrist, it's traditionally seen that the guan is wiry. I don't even use the word wiry actually, because that keeps you stuck in these concepts of, an image like this, and that you're feeling a quality rather than you're actually feeling what is going on in the body. But certainly a pressurized pulse at the left guan is very common when the liver is under some amount of tension, which helps with concentration and focus. Otherwise, at the left guan and at all the pulses, it should be convex. So the arterial wall is flexible and pliable, but also strong and solid. And as well, we're not just reading the pulse. This is something I haven't really covered in these notes, but it's not just the pulse that we're reading. We should also be reading the artery wall. We should be reading the fascia around the pulse and what the fascia is saying. And we should be, rather than trying to feel what is, for example, there's a great little insight. So the left sun, the heart pulse, rather than just feeling, is it choppy? Is it wiry? Is it deep? Listen to the rhythm. Listen to the rhythm. You have the atrium and the ventricle on the left side. Doo-doom, doo-doom. They should be operating like that. You can tell, for example, a mitral valve dysfunction. So the mitral valve is in between the left atrium and the left ventricle. When the mitral valve is when one of the flaps of the valve is flaccid, then some of the blood, when the left ventricle squeezes, some of the blood can regurgitate back up into the left atrium. So the ejection fraction, the amount of blood that comes out of the left ventricle into the aorta, is reduced. And that can be felt in the wrist by, instead of the pulse going doo-doom, snapping in and out sharply, it's like it fades off afterwards. It goes doo. It's like it's got a fuzz, if you like. Doo, doo. And that will be the mitral valve. There'll be a mitral valve stenosis or dysfunction and regurgitation. So remember that. You can take a screenshot if you like. That's a normal pulse. Remember that always. It's very simple. If the if the position that you're feeling is not in its natural position, then just treat that organ. Treat the organs associated with that, and you'll do well. That's the simplest way. If you're tired, if you don't know what you're doing, just do that. Then also, you thought that was a little complicated. We're going to go more complicated, but it's actually very simple. We teach you step by step how to do this. So we've got 3 positions for each position, 3 subdivisions of each location. And we're going to roll the finger in each position to feel those 3 positions. This can give us extraordinary depth in what we're feeling, and to feel all the way through the organs, all the way through the skeletal system and the musculature and the fascia, and really get a lot more detail. So what can we diagnose with medical pulsology? These are the parts of the body. We want to scan down from the brain and even the meninges, these 3 layers around the brain that cerebral spinal fluid flows through. The vestibular system, the ear, nose, and throat, the sinuses, not just the nasal cavities when we say sinuses, but the canals in the skull. So when there's good movement of fluids through the canals in the skull, then there's good memory, good concentration, good brain function. When they're congested, you get brain fog. Feeling the jaw, the temporomandibular joint and the masseter muscle, feeling when there's tension in the muscle, and if that's been chronic, then often you'll get TMJ problems. Thyroid, throat, the lymph in the neck, the esophagus, neck and shoulder tension around the base of the occiput, the whole spinal column, all of the organs, the diaphragm, pleural cavity, the rhomboids in the back, the trapezius, not only and with the esophagus, you can feel stomach acids coming up the esophagus. Not only acids, but you can feel silent reflux, like stomach acid vapors rising up and causing headaches, causing eye problems, causing thicker mucus in the sinuses, causing tinnitus. And there's a whole way that you can start to do some investigative work of why people are suffering certain symptoms, and therefore how to resolve them, and how to resolve them fast, and how to resolve them long term. Also, with the kidneys and the gallbladder, in terms of kidney stones, can't actually feel kidney and gallstones in the organs. Apparently, there's a lot anyway that everyone has, but you can feel when they're too big and they start to irritate the ureter or the bile ducts. So bile ducts from the gallbladder to the duodenum, or the ureter from the kidneys to the bladder. And when the stones are too big, then you get that sharp pain. It's called, if someone says, I have kidney stones, or I had a kidney stone attack, or, when they need their gallbladder removed, when they're told they need their gallbladder removed. I've never had one patient need their gallbladder removed. Yeah, you can feel exactly, well, to a large extent, what's going on. Then also breaking down the digestive tract, as we spoke about already, feeling the bladder, feeling the adrenals and the kidneys, going through, as well as the lower spine, being able to differentiate between the lower spine, the sacrum, the coccyx, the hips, whereabouts in the hips there's compression or inflammation and pain. Reproductive system, not only women, but also of men, including the prostate and an enlarged prostate, and then down through the lower legs. And the conditions, the sort of conditions that you can pick up. I've gone through a lot of this already. What else is there? Things like diabetes, and whether it's preclinical or full-blown type 2 diabetes. Yeah, what else is there? Okay, the tumors, cancer. It's difficult to diagnose blood cancers, but tumors, a lot of the time you can diagnose those. When someone says they have IBS, what the hell does that mean? I don't know what IBS means. It's just a vague category for someone's got bloating, they've got digestive discomfort, they've got something going on that is giving them diarrhea, constipation. It's nonsense. It's not a diagnosis. It's a vague categorization. We can be very specific. We can help people very specifically understand what is going on in their digestive system, why, and how to remove those problematic foods or medication or whatever it is. And again, also if the liver is inflamed, if you have a fatty liver, or whether it's just compressed, or whether it's suffering from deficiency, from protein or nutrient deficiency most of the time, or maybe just functional deficiency in general. Even parasites and the effects of antibiotics, particularly longer term antibiotics, as well as antibiotics, the microbiome. How efficient is the microbiome functioning? You can tell that as well. Often people are diagnosed with arthritis, and it's not really arthritis, it's just compression in the joints. Arthritis is really where the cartilage on top of the bone has worn away on both bits of bone, and now it's bone on bone, and that's the pain of the bone, the inflammation, the itis of the bone, and even cramp, even poor blood flow to the legs. You can diagnose with medical pulsology. This is really, for me, the emotional, spiritual patterns. This is really where you start to elevate yourself in the patient's mind from an efficient clinician to someone who is they would trust with their life, basically. If someone comes to you with stage 4 cancer and they've been given 6 to 12 months to live, for example, this is my bread and butter, is where I really thrive, and really my passion is engaged. The most complex conditions of health, to give someone reassurance, belief, faith that maybe what this person is talking about is actually possible, that the recovery is possible, is a deeply fulfilling thing. And a lot of that will come down to identifying emotional patterns. And emotional patterns are tensions. They are tensions either in an organ or in a myofascial pathway, in a chain of muscles. Right? And these tensions are stopping blood flow. They're stopping the delivery of oxygen and nutrients to these areas. It might be to an organ. It might be to a whole, a whole sort of channel of the body. And to relieve these, yeah, you can use acupuncture, but by working on identifying these imbalances to the person, can really help them let go of these long-term emotional, mental, and spiritual patterns. And by spirit, what are the spirits? For me, they are the Jud, the willpower, the Po, the corporeal soul, the Hun, the the dreamer, the strategist, the decision maker, the consciousness, yeah, and the concentration. These are motivating, animating forces. They give us good spirits. They keep us in good spirits. And all of these emotions listed here, they are either beneficial aspects of the organs, or they are things that impair the organ's function. So hopefully that's given you a little bit of an idea. And really, I'll give you the big secret. The original title of this talk was uncovering the secret of pulse diagnosis. And the secret really is empathy. The theory, the structure of the course is important so you can learn well. But you want to get away from that structure once it's been well learned, and you want to feel the pulse, not thinking, is this wiry, is this choppy, is this slippery, is this deep, but to feel, oh wow, this person is worried about someone male in their life, in their immediate family, or there's someone probably in their work environment who's putting too much pressure on them, and they're starting to give them apathy and a sense of frustrated disappointment that there's no point doing this job anymore. That's really when people start to think, what the hell is this? How are you doing that? How are you doing that? So you can see the picture on the top right is a patient who is reading her pulse for the first time. And people really often talk about being blown away. And then it's my only AI image, but I like this one of the physician reaching into the heart of the patient. It really is what we're doing and what I want to help you discover how to do. So if you want to come and learn from me, the Medical Pulsology will be structured learning system to take you from novice or from competent, wherever you feel you are, onto mastery, with the four-step process of understanding the best ways to position yourself and the patient, how to find the positions, looking at palpation, what are the qualities that you want to feel, how should you be thinking about the pulse when you put your finger on a pulse, the patterns that you're picking up, and how those translate into physical, mental, and emotional conditions. And then the plan, the treatment, and the aftercare. How are you going to use your diagnosis? It doesn't matter, as I said, it doesn't matter if it's acupuncture or herbs or functional medicine or a doctor. You can apply whatever practice you want to the diagnosis, whatever treatment you want to the diagnosis. You can apply whatever theory that you have learned and that you practice. If you do 5 elements, you can apply that theory onto this. If you've done TCM, you can apply that theory onto that. If you've done stems and branches, same thing, you can apply it. So a little bit of evidence of what people feel it's like working with me long term. These are patients. As I said, this is my first time I'm opening up the training, but people really feel like they get much better treatments from the effectiveness of the pulse reading, because it can be laser pointed, the treatment, when you really understand in great detail where imbalance is arising and how to redress the balance. So if you want to come and learn with me, the first workshop is on the 3rd and 4th of May at Goldsmiths College in London. We've got an early bird price on this finishing and tomorrow evening. And there's also an extra discount code for you as a BXC member, so you can get £150 off the full price. So please, I'll put this link in the chat, so you can just click on it in a moment if you're interested in checking that out. You're very welcome if you are in the south of England to come and observe at the Get Well Clinic. As I said, it's high volume of patients. Friday afternoons, we will soon be increasing from 10 to 14 patients. So Tuesday is 4.5 hours. So 4.5 hours, treat 16 patients. we just need half an hour at the end for the last patients to finish their appointment. It's treating people every 15 minutes. And Friday is 3 hours. And I'm an open book. So anything about how the clinics have been set up, marketed and run, all the systems that we use, how I am reading the pulse, applying the treatment. I'm very, very happy to divulge all that information. And then mentorship and online training. It hasn't been launched yet. Waiting for this first workshop for some of the footage from that to really make sure the training is comprehensive. But yeah, a few people are interested in getting more involved, and I would really, really love to help you develop mastery because, as I said, it's been so lacking. So if you want to connect with me any further, if you can't come on the 3rd and 4th of May, but you'd like information on future workshops, there will be probably another 2 or 3 later in the year, then please do send me an email at info@georgemonkhouse.com. Connect with me on Instagram, also on LinkedIn. And the Get Well Clinics is a little bit of a view of what our Camberwell clinic looks like, which is where I work. And we are expanding. We're looking to have 15 of these pop-up clinics around London. If you've been in practice for 3 years and you are happy and believe that you can treat patients in 15 minutes and still give them top quality treatment, then please do send an email to Helen at info@getwellclinics. And that's it, really. Thank you so much for listening. I'm happy to open up. I see there are some comments. Happy to open up to any questions. But I hope that's given you a bit of an insight into what's possible. Yeah, there is a video on the link here, on the link at the bottom of the training section. If you go on there, there's a video of me doing a pulse reading. If you haven't seen that already, it gives you an insight into what it's like to do in-depth pulse reading with my system.